chiropractic success for older people is what we'll talk about. In a moment, I'm going to give you several cases of people that have come to see me in their 70s and 80s and 90s that have a variety of complaints, and they're going to do much better with their chiropractic care. So I'm going to talk about their conditions, what we did for them, and the results that they had. I think the message here is quality of life for older people can also possibly be helped with chiropractic care. Not every person that comes into a chiropractic office gets the results that I'm going to share with you with a half a dozen people here today, but the point is it's never too late and it's never too early to start caring for our spine, the function of our nervous system, stimulating those powerful nerve networks within and around the spinal soft tissues, which is the whole principle of chiropractic, and then seeing what kind of changes that we can evoke in the human body with adding those mechanoreceptive, those neurological inputs into the human nervous system with the chiropractic care. Another take-home message from this is none of these patients I'm going to share with you in just a moment ever received a manual chiropractic adjustment. They didn't receive the crunching and cracking. None of them did. As a matter of fact, in my practice, the vast majority of people do not receive those adjustments. We'll explain more of that later on the types of treatments and adjustments that we do in my office and how they work. But keep in mind, again, a lot of people are afraid to see a chiropractor at any time of their lives, whether it be, gee, I don't want to bring in my infant or my 6-month-old, or I don't want to go myself, or elderly people might be thinking, well, I can't go to a chiropractor, I can't have my joints and bones cracked and so on and so forth. No, 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 no. That's not what we're doing in most cases. So chiropractic success for older people. I'm going to give you several examples of people that we have cared for. The first woman I want to talk about is an 87-year-old woman, just a darling of a person. She's such a wonderful, spirited individual, so happy. Now, I'm going to try to get into the position that she's in. She is an example of somebody, she's still walking, by the way, no cane, but she is bent over like this, bent over that far. I can't even get into the posture that she has. So she can barely look straight ahead, big hump in her back like this, but she'll walk in and she'll be so pleasant. Hi, how are you? Good morning, and so forth. She's just very, very happy, but you can tell she's suffering. And at age 87, she is still driving too. So she comes in like this, she's referred in by someone else, and I'm looking at her and I'm thinking, gee, I hope I can help this person, right? So she's got chronic low back pain and sciatica. She had it for 2 years. She couldn't sleep in her own bed because the pain is so bad, she has to sleep in a recliner. Now, her posture is so far over, she can't even lie on my chiropractic table. She can't lie on her tummy, she can't lie on her back. Her posture is just so bad. Okay? So what did we do? The only thing we did was sitting treatment. We did sitting treatments in the office. So she sat on my table, and I used 2 therapies. We're going to talk more about these later. A light force instrument up and down her spine, and a cold laser, low-level laser therapy, and I have a class 3 laser that doesn't generate heat, so I used laser and the instrument. And in 6 months, we took her from chronic low back pain and sciatica to no pain. And she came in still bent over like this. We didn't change that, by the way. Her posture is still like this, but she came in, Dr. Fuller, you wouldn't believe it. I am totally out of pain now. This is wonderful. And you could really tell that she was just thrilled beyond belief to feel so much better. I was absolutely astounded. I thought it was just a fantastic result that we had. And she's happy now she can sleep in her bed and she's not suffering. What's interesting is I made a joke with her too. I told her everything was my fault. I should have had her under chiropractic care 80 years earlier, so we might have been able to preserve this part of her posture and so forth. Maybe she wouldn't have suffered. But the idea is this: with simple, non-aggressive chiropractic treatments, we took her from pain to no pain in 6 months. It was really inexpensive. She enjoyed the treatment, and her quality of life is so much better. No, we didn't fix that problem. I don't think anybody could have fixed that, but we definitely improved her quality of life. We've talked about this take-home message here. Unfortunately, she declined all the way down here. Here she was coming in, but the point is never give up, and she's thrilled. And it was a lesson for me as well, because when she first came in, I was like, I don't know if I can help. And I tell people that. I don't know, we can try, but I'm not sure. And sure enough, she stuck with it. So it was just a fantastic result. Now we're going to talk about a 91-year-old woman. And now she's been coming into me for better part of 15 years now. And we had her on once a month maintenance care. Once a month. We do that a lot in my office. A lot of my patients choose to come in for maintenance care. They come in for tune-ups because they're so happy with how bad they were and then the nice changes that they made, and they want to keep those nice changes. They don't want to wait for the next catastrophe, so they decide to come in for tune-ups, right? So she was coming in once a month, but what she had was her lower back pain was worsening. She was really having trouble getting around. She had fallen last year and broke her hip. After that, she didn't recover fully. She's walking in a walker, but of course, being on the walker with the hip, she's leaned over, now her back's hurting more, and so forth. So I made the suggestion, I said, why don't you come in twice a week? Let's have you come in twice a week, and we'll do that for a while. We ended up doing it for a couple of months. So we started working on her twice a week. Again, no manual chiropractic adjustments. We did my specialized chiropractic drop table, that light instrument that I talked about earlier, and a little bit of tissue work. And in a couple of months, we dropped her pain from an 8 to a 9 over 10, 8 to 9, 10 being the worst, 8 to 9 over 10 to a 2 over 10 in 2 months, with a 91-year-old woman probably loaded with degeneration and arthritis and wear and tear, but we were able to significantly improve her quality of life. She can now walk around at times without a cane and without a walker. She's doing a ton better, and I thought that was just a fantastic result. Another one, never give up, somebody in their 90s getting better. An 82-year-old man comes in to see me. He's been a patient of mine for a better part of 20 years. But he would only come in to see me when he had crippling lower back pain episodes. So he would work in his yard really hard one day or 2 days, and then he would come in all busted up, right? Sound familiar? A lot of people do this. And then I wouldn't see him for several months, and then he would rake leaves all day, and then he would come in busted up. And then he would shovel snow and then come in a few times, and I would patch him back together again, and then he would take off. And I said, you know, I wonder, would you be interested in coming in for once a month maintenance care? So he started once a month wellness, and now we have his lower back down to either nothing at all, 0 over 10, or maybe a 2 over 10. And even when he works more around the yard, like if he's doing extended yard work, shoveling snow and so forth, and of course I've shown him how to do that a little bit better, he's not getting the crippling lower back pain either. Well, to add on to this case, again, he's 82, he has knee pain, his knee pain is getting worse, he gets x-rays and so forth, he's told that he needs a knee replacement. This was 3 years ago that he said, I need a knee replacement. I said, so he asked me, what can you do for my knee? I said, I don't know, but I can try. He says, please try. So I start working on his knee, and I do some very light adjustments to the knee, doesn't feel anything, no pain. I do a little bit of tissue work on his knee, and for some people I'll show them a strengthening exercise or two for their knee. His knee is now doing much better. His knee was at a point where walking was difficult, one of his favorite exercises, and he also likes to dance. He likes to dance for exercise, and that was inhibited from his knee problem. Okay? Now his knee is at a point that he can go for a half-hour walk if he wants to, and it's not bothering him, and the dancing is going fine. So we took a knee that is worn down to nothing, cartilage is gone, and we're able to do a couple of simple things, and again, improve his quality of life. He doesn't have the crippling lower back pain episodes any longer, and his knee that he told needs to be replaced, he says, I'm going to put this off as long as I can, hopefully forever I won't need that. Now again, not everybody responds in that manner to that, but boy, he's really happy he gave it a shot. I've talked about Gail in the past. Gail is 74. She had terrible low back pain. She wrote an amazing testimonial, which is on my website as well. In October of 2012, she says, I didn't know how I was going to be able to get through the rest of my life with this chronic, constant low back pain that I have. I exhausted all the medical opportunities and to no avail. Luckily, she said she had been to me in the past, so she came into me. She was barely able to walk or work, but for 2 hours per day before she saw me, and she actually had to take an early retirement. The pain was so great, I had little hope of ever returning to the active life I was accustomed to, said Gail. And I constantly reassured, let's do the best we can, and so forth. At times I would lose hope, but I would continue to encourage her, and through the constant care and generosity, I'm more than grateful to say that Dr. Fuller has done just what he said he would do. Thank you, Dr. Fuller, for dedication to helping others and returning me to a happy, active, useful life. Here's what we did with Gail. I saw her daily. Every day my office was open for a year. Why did we do that much care? We did that much care because she basically couldn't do the things she wanted to in her life. She could only stand about 2 hours a day, and for the rest of the day she had to lie down. She says, I don't have a quality of life right now. This is not worth me living. And she is a super active person. Even into her late 60s, she was an aerobics instructor. So you can imagine how active she was, and this really took her down. The second year we worked on her, I worked on her 3 days a week for another year. And then the third year, up until now, we see her once per week. But it took us to get to that point where she says, I have my life back, life is worth living now, I can walk 3 to 4 miles, I'll do my power walk up hills and so forth, I can swim, I'm enjoying my activities, I have my life back. And Gail said it was totally worth it. Now that is on the outside. You'll see that the other people that I'm talking about, it wasn't 3 years of care, it was more like a month or 2 or 6 months of care to get them back in shape. But that's what it took for Gail, and she's happy that she needed it. She's an outlier to take 3 years to get her back in shape, but nevertheless, she didn't give up. The next case that I want to talk about right now is an 82-year-old man. He was referred to me by the family. He has low back pain and leg pain with difficulty walking. He says, I can only walk about 5 minutes before I need to sit down, okay? Now, there's a medical diagnosis oftentimes associated with that. It's called intermittent claudication, which means that somebody can only walk a little bit, and the longer they walk, their legs get weak, they get burning, they get pain, and they need to sit down, okay? Oftentimes, that is caused by a syndrome called Canal stenosis, and that means that if we look at the spinal canal, if you will, if we tip the spine like this, there's a long tube in the spine where your spinal cord goes. The thick cable from the brain down the spine is the spinal cord. Follow? And then you have nerves that come along each side of the spine that come out as well. Well, that tube that houses the spinal canal, the spinal cord, that tube can get smaller over time and can start to squeeze on the spinal cord. That is called canal stenosis. The tube is getting smaller. The things that do that are disc bulges, arthritis, inflammation, and bone spurs. So all of those things can make that tube a little bit smaller, and it starts to squeeze on and encroach the spinal cord. It can also begin to pinch down on the nerves that exit the spinal cord that go down into the legs. My suspicion is that he has some canal stenosis, and I'm working with his primary care physician to get him an MRI to see if that is the case. Okay, so regardless of that, he's working with me in the office, and just like the first case that I had mentioned, he can't lie on my table, he's too uncomfortable. So what I'm doing is I'm doing sitting treatments, I'm using a light force instrument, I'm using a industrial powerful vibration instrument, and I'm using my cold laser on his lower back. And lo and behold, he's getting improvements. Is he still having leg symptoms? Yes, but they are much less. He can walk longer now. He can be on his feet longer at this point. And what I have him doing is also doing exercises. So he's doing spinal exercises to his tolerance. All of my other patients that I've mentioned so far are also getting exercises for their ability. And more on that in a moment. So he's doing exercises every day. I have him walking for 5 minutes. Up until the point that he needs to sit down, that's when we have him stop. So if it's about 4.5 minutes, that's what he's doing, but he's doing that once per hour. So we're building up strength and stamina into his system within reason, plus the spine exercises, plus the in-office chiropractic treatments. He's better now than 6 weeks ago when we started with him. Okay? So that's a good case. Even if he has canal stenosis, which he might have, what our job is to make his inflammation come down and his quality of life as good as it can be. Other people with canal stenosis, they're more of in an emergency situation where they do need to have surgery, and in some cases, surgery is necessary. In his case, we don't know yet, but maybe he'll be able to avoid a very serious surgery that he would have there. Okay. And then the next case is an 83-year-old woman. She comes to see me. Now, she's another one that had a posture like I showed you earlier. Her posture is like this. Now, she was having more chronic neck and upper back pain. No surprise from trying to hold up that 13-pound bowling ball out here all day long. All of these joints and discs and ligaments and nerves get all inflamed up in here. And so she comes into me with that chronic upper back and neck pain, okay? So we start working on her, and we knock that down considerably, where her upper back and neck are anywhere from a 0 to a 2. She gets stiff and tight up in here, but she doesn't have that chronic pain anymore. Score. So we did some great work with her. Well, she's another one. She says, my knee is terrible. And you can even look at her knee. You wouldn't even need to be a doctor. Her knee is swollen up like this, right? She already had an x-ray. It's bone on bone. All the cartilage is gone, and she probably needs a knee replacement. She said, Dr. Fuller, what do you have in your bag of tricks? Can you help me? I said, I don't know, but I can try. So I start working on her knee, similar to the man that I said earlier, some light adjustments with my specialized drop table, a little bit of instrument work. That's it. That's all we did. We took her knee pain from a level 10 to a level 2. She was walking with a severe limp to still a little bit of a limp, but much better. She says, I'm not having a knee replacement if I don't need to have one. So, and that makes sense. At 83, do you want a knee replacement if you don't have to have it? So we're doing well, and these are cases of a bunch of people really seeing some improvements. So you can see people in their 70s and 80s and 90s getting excellent help, better quality of life with conservative chiropractic care, no manual adjusting, and it works great. Not everybody gets these types of improvements, but why not try it? Makes sense to me. So about the treatments that all of these patients had. First of all, they weren't having the manual chiropractic adjustments. Most people in my office don't. Some people do. And we decide on when we pull that tool out, and when it works, it tends to work very well. We use a specialized chiropractic drop table, and maybe we'll do a show sometime. We'll take a field trip into my office, and I can show you what I mean about this. But we use specialized chiropractic drop tables, very light force stuff. I use an instrument. I have a couple of different instruments that I use in my office that give light taps. And what do these light taps do? Well, it stimulates pools of nerve endings in the soft tissues in and around the spine. And when you fire those pools of nerve endings, they increase the traffic into the nervous system. And those specialized nerve endings, they're called mechanoreceptors, by the way. Those specialized nerve endings have the ability to shut off or dilute or close down some of the pain messages. So when I'm turning on one sort of set of nerve endings, it shuts off another. I tell people it's kind of like acupuncture. Now, acupuncture has been around for a couple of thousand years for a reason, because it works. What happens is they put a very, very fine needle into the skin, stimulating special nerve endings in the skin, which sends neurological input into the nervous system to try to change the physiology. In the case of pain, they're trying to dilute and shut down some of the pain and re-educate the nervous system. Okay? So we have the specialized instrument. I have this instrument called a cold laser. It's called a cold laser because it does not generate any heat. Now, there are lasers for different reasons. The one that I have is called a class 3 laser. It doesn't generate any heat. You can look it up on the web. It's called low-level laser therapy or cold laser. The particular model that I have, the company that I have, is called Erconia with an E, Erconia. So you can search on that. There's plenty of research. They're FDA approved and so forth. And you can see how those work. I've had some fantastic improvements with laser, not in every patient, but when I pull it out and use it, it either works or it doesn't. When it does, it works great, just like several of the cases that I told you here. I will sometimes do some soft tissue work depending on the condition, depending on the patient. If it's a shoulder problem, a knee, a thumb, a bunion, whatever it might be, we'll do some soft tissue work. We definitely do exercise. Just a couple of weeks ago on the NPR show On Point, they had an hour show on back pain. And on this show, they had a surgeon and they had a layperson who just wrote a book about her experiences with back pain. And both of them agreed, only do surgery if absolutely necessary. And I think everybody agrees with that. I even think the orthopedic surgeons and the neurosurgeons say, you should only do surgery if you absolutely need it. And if we have defined, we have a particular goal in mind and so forth. Or an emergency surgery. Those are the driving pain down the leg, not getting better, leg weakness is getting better, bowel or bladder dysfunction, which we screen for in my office as well. That can be oftentimes an emergency surgery, so you need to know that. Okay? But what they're saying is the conclusion of the show with back pain is surgery if only necessary. Besides that, you want to do stretching and exercise to your tolerance, chiropractic care, acupuncture, therapy, massage therapy, mindfulness, meditation. And they talked about more exercise and more stretching and more chiropractic. And that's what all these people were calling in and said, that's worked for me. This was definitely the way to go. Even people post-surgery are saying, I don't want to have another surgery, so I'm really delving into appropriate exercises and so forth. So I use that as an adjunct to my therapy all the time. I've been on this show. We have done dozens and dozens of shows on spine stretches and full body exercise and working out and resistance training and cardiovascular training and moving your body, managing the sitting position. Sitting is the new smoking. We've talked about these things again and again, and we will talk about it as well. Exercise being such an important component of what's going on, so I can give people homework to add on to, they're going to be making improvements in between their chiropractic visits. Also, when we get people to the near normal or maximum benefit with the chiropractic care, then we put you on maintenance care if you so desire. But then we have you continue with those exercise programs for the rest of your life. If you're going to be brushing your teeth for the rest of your life, why not keep doing exercises for the rest of your life to keep you in the best shape possible? So that's part of the program. And then, of course, I talk about nutrition. I talk about nutrition because it's so important. It's the most important thing. Nobody wants to do it. It's really hard, but when you do it, it gives you amazing rewards. And I talk about people, back to that canal stenosis activity, and I mentioned the word inflammation. Inflammation is a flame burning in your body, and you have inflammation of all your 50 trillion cells. You're going to inhibit healing. You're going to have more pain. You're going to have more arthritis. You're going to have more heart disease, more cancer, more chances of Alzheimer's and dementia and blood vessel problems and stroke and all of these other problems when your inflammation goes up. The number one source of inflammation is the foods you choose to eat. So if we put somebody on a high vegetable diet, clean food, less meat, appropriate grains, enough water, getting them off the processed foods and garbage and sugar and so forth, we clean up their nutrition to the best of their tolerance, whatever they're going to handle. Their conditions get better, their disc problems get better, their neck and back pain issues get better, their inflammatory arthritis or osteoarthritis gets better as well. We are talking about this in my office consistently. It helps me. It helps all of us that are talking about this. The more we talk about these things, the more we work together as a team to make all of our health better. The ultimate goal for all of my patients, whether it's somebody in their 70s and 80s and 90s starting chiropractic care, even with a chronic degenerative problem, or a baby or a 6-month-old or whatever it is, whoever it is coming in, a high school athlete, it doesn't matter. The ultimate goal is to get people on a wellness care program. We get them to the best version of themselves, and then they end up like this older couple that comes in to see me. They are 78 and 83 years old. They've been coming to me for, again, 15 or 20 years. They come in once a month for their tune-up adjustments, and they love coming in. Neither one of them have any spine pains right now, and that's a wonderful thing. The gentleman that came into me used to have terrible back flare-ups, again, with stuff around the house and yard work and so forth, and he's doing great now. And he's a regular walker. He tries to walk an hour a day, 365 days a year, as close to it as he possibly can, unless it is a blizzard or a bad rainstorm. And she's doing great. She's coming in for her tune-up adjustments. They are walking for exercise. They are thriving. Their postures are doing great. You wouldn't guess them at 78 and 83 years old when you see them because they're bucking the trend. They don't have the postures that we all deem as so common and such a, we think that this is a normal degradation because it is so normal, but it's not. It's not the way that it was supposed to be. We know people in their 80s and 90s like Jack LaLanne that are just like this when we get older. Just because we're in our 70s and 80s and 90s doesn't mean we're condemned to being like this. The reason you hang around with a chiropractor like me and other natural healthcare practitioners is make sure as best we can to avoid this downslide and to keep our quality of life to as close to this situation as possible. As we now know, when your posture is more upright like this, you're going to have a better quality of life. You're going to have less chronic pain, and that's the idea, to get to that ultimate goal of that tune-up type of lifestyle in a chiropractic situation. Chiropractic is not the only thing. If you're doing the chiropractic thing but not exercising, you're going to have limited results. And if you're not eating healthy, you're going to have limited results. If you're not controlling and reducing your stress, you're also going to have limited results too. It's a full package. We've done some shows recently on the opioid epidemic. Now, the opioid epidemic is a huge problem now where people are in chronic pain. 1 out of 2 adults in the United States, 1 out of 2, 100 million out of 200 million adults in the United States have chronic pain. The #1 body area for chronic pain is the lower back. Well, I just gave you example after example of people in their 70s, 80s, and 90s with terrible conditions, terrible postures, severe degenerative disc and degenerative joint disease in their spines, terrible wear and tear, and bad straits, and they come in to see me, and we're able to get them better. So chiropractic can be one of the solutions for the opioid epidemic, getting people to at least try it. Maybe it will help. I know it would help a lot of people. I've had thousands of patients now, and almost everybody gets fantastic results. We know that alternatives are needed to this opioid crisis. Many of us as chiropractors are trying to get the word out, and I have on other shows as well, talking about opioids, that when chiropractic goes head-to-head to a lot of the commonly prescribed painkillers and over-the-counter painkillers, chiropractic is winning. Chiropractic is much better than Vioxx. Chiropractic can outperform other non-steroidal anti-inflammatory drugs for both acute pain and chronic pain. This has been demonstrated. So people need to try the chiropractic options. Now you know the manual chiropractic adjustments, the cracking and popping adjustments, is not the only one that's going to help people respond to chiropractic care. Just the light force techniques, and then adding in the exercises, the posture, and so forth. Just for a moment with the exercise. Remember the first woman that I talked about that was like this at age 87? I showed her one exercise, nothing else. She couldn't do the twists and the bends. I had her doing this exercise. She would pull up her shoulders and her chin. And this is about as far as she could go. So I would have her do this once an hour for 20 seconds. That was her only exercise. And then she would relax and, go back to this. So in 6 months, 8 months, whatever it was, I might have moved her from here to here. Probably imperceptible to most people. But to her case, that was the thing that helped her take a little bit of stress off the spine, a little bit of stress off the discs, and there we go. The gentleman that's coming in with suspected canal stenosis, spinal cord irritation, nerve irritation down his legs. I have him doing 3 exercises. That's one of them. And then I have him doing some gentle twists, which I've talked about in this show, and some gentle side bends. He's doing maybe half a dozen of those once an hour with his 4.5-minute walk. You see? So I'm teaching them a little bit of exercise that is appropriate for their condition. Sometimes it's only one. Now, Gail that I showed you earlier, she's probably doing 15 exercises and stretches because she's active enough and limber enough and her condition can tolerate a lot more exercises. So we tailor make that. But those are the alternatives that are needed. We need to take this 100 million adults in the country and say, look, changing your nutrition can decrease your pain. General physical exercise to your tolerance may help decrease your pain. Reducing stress can help decrease your pain. Chiropractic is a powerful alternative to decreasing your pain. Drinking more water and getting away from too much caffeine can help decrease your pain, and so on and so forth. General physical exercise, spinal stretches, and so forth can help that. We need to help people, giving them alternatives so they can do that. Your wellness plan, you watching this show right now, your wellness plan to get you in the best shape possible, as I like to say, the best version of yourself, is to do the wellness plan. That is the chiropractic care, not just the short-term thing, not just coming in when your back blows up, but coming in for chiropractic wellness care. Eat the cleanest diet that you possibly can. I think that everybody knows how to do that. I see that people need to be drinking water on a regular basis. Half your body weight in ounces per day. And I've done a show on that as well. We need the general physical exercise. We need to be getting more sleep. Most of us are not getting enough sleep at all. We need to be taking a look at that. Shutting off the TV. Right after the show is over, shut this off and get yourself into bed a little bit easier. We need to be reducing stress. We've covered that on prior shows. Maybe adding in some other alternatives like massage and acupuncture. But as you now have learned, is the gentle, low-force chiropractic techniques, even for people in their 70s and 80s and 90s, can be extremely effective for improving your quality of life. I'm Dr. Scott Fuller. Please join me again.